Hi everyone, this is Dr. Shweta Patel. I'm so sorry for running a little bit behind schedule, but as you can see, I am in a different part of the woods. I'm actually visiting family this weekend, and I just got done driving up, so apologies for that. Today's live is going to be a little brief for the same reason, and what I wanted to discuss was why it's really important to make sure you have your mental wellness also addressed when you are having your annual physical or exam. And this is not something that women expect too often to have discussed at their gynecologic visit, and it's something I definitely try to incorporate in mine, because I personally and professionally feel that women are so they're such emotional and mental beings, and our health, sorry for the sound, our health can be so tied to our emotional and mental wellness, that if something is not going on okay with us in that realm, it can start manifesting in a physical sense and be the source of a lot of other ailments as well. So first and foremost, what do I mean by mental wellness? Having a balanced mood and having the ability to feel, emotionally good, happy, focused, and feeling like you're enjoying things. And so when I typically start out in an exam, I ask just plain and simple, like, how are things going with you in life in general? How are things at work? How are things with your relationships? How are things going socially or professionally? And just starting the conversation off that way. It doesn't have to be like a depression screen or anything like that, but a basic conversation can be very insightful as to how things are going in a woman's life, and from there, usually making sure that your relationships are doing well, making sure that you are feeling happy and enjoying the activities you normally enjoy doing, making sure that you are feeling sharp, focused, your mental faculties. Oftentimes women come to me and they say, I just feel like I can't remember things, or I feel like I'm in a fog. I feel like I'm sleeping all the time and yet I'm always tired. And that is a kind of one of the signs that I look for emotional or mental fatigue, and can also be a sign of depression, or feeling the inability to rest or shut your mind off, feeling like you can't fall asleep and your thoughts are racing. That can be a potential sign of anxiety. I know personally I have suffered from anxiety and depression, and I think a lot of women in the health care field experience the same. It's given how much high intensity the work environment can be for us, and so we look out for each other, and we're always on the lookout for signs of anxiety or depression, or just feeling off balanced. Now, outside of those signs, there can be other things, such as a change in your appetite. Some people respond to not feeling balanced by eating more. Some respond to it by eating less. Subsequently, that can also have an impact on your weight. Not feeling like you're getting quality sleep, feeling irritable, forgetful, and if any of these sound like they are kind of ringing a bell, I would definitely encourage you to bring it up to your family, to your friends, and especially to your physician. Now, what can be the signs of this? What can be the cause of this? So anxiety, depression, feeling off balance can be hormonal, and oftentimes women will come in concerned that there's something off with their hormones. Not typically your female hormones, however, and that's the clarification I definitely want to emphasize. Though when our estrogen and our progesterone levels are changing throughout our menstrual cycles and throughout the month, it can affect your mood. But if you are feeling like this more days than not, it's possibly not related to estrogen and progesterone and testosterone levels. Hormones that I like to specifically think of are thyroid and making sure that that's not off balance. Another important blood test to check for is vitamin D levels. Believe it or not, a lot of women in Florida are vitamin D deficient. It's baffling to me because of the fact that I think of it as a sunshine state, and you would think that everyone is more than enough proficient in vitamin D, but have your doctor check for your vitamin D level. Most adult females should be taking a vitamin D supplement, and if you're taking a multivitamin, just make sure that there's 100% daily value on the back for vitamin D. The other part is if you're taking vitamin D, but you're not taking it with some kind of food specifically that has fat in it, it won't get absorbed as well. So you could be taking all the vitamin D in the world and it's not staying in your body because it's a fat-soluble vitamin. But vitamin D can be a game changer if your levels are low in terms of your mood. And then other sources, lack of sleep. So new moms, in addition to their hormonal changes, will experience depression because of the lack of consistent and restful sleep. Sleep deprivation, I often say it's used as a tactic in when someone's being interrogated, and it can actually work to mentally break you. And so lack of sleep can definitely affect mood. The other things include lack of exercise, anemia, and of course social stressors, and then of course if there's something that recently happened, if there's been a change in your life, having a response to that, like if there is a loss of a family, or if there's been a death or a loss of work or health concerns, those can definitely cause transient changes in your mood. And that's not per se normal, but that's expected. And that kind of a transient response is just part of being what we are as humans, that we're feeling. But if you feel like even though everything is relatively the same or everything is going well, and yet somehow you can't snap out of it or you don't feel like yourself, that doesn't sound normal. And you should bring it up to your physician. Lastly, how do we treat this? And this I find really, really important to address, because women may feel like there's something going on with them, but then they are apprehensive about treatment for anxiety or depression. Some feel like it's kind of like they're cheating, like as if they should be able to just toughen up and sort it out on their own. And I would say that, there are certain kinds of mood imbalances that you can actually correct or improve upon with counseling, therapy, motivational speaking, and, surrounding yourself with good support. But then there are just organic imbalances in our brain, and they're not going to be something that just disappears with willful thinking. And what I mean by that is, just like your thyroid or like your pancreas, your brain is also an organ that is very much dependent on chemicals to communicate with the rest of the body. And if you had diabetes and your doctor told you needed to have insulin because your diabetes is your pancreas is not producing enough insulin, you wouldn't be trying to mentally will your way through fixing that problem. You would understand that that's just something that is going on and it needs to be treated. On the same line, if your brain is going through the neurotransmitters that it normally is able to use a little bit slower, and it's churning through them, whatever the reason is, and you are experiencing lower levels of things like serotonin and dopamine and norepinephrine, are three most critical neurotransmitters that we use to convey so many complex emotions. Even a slight imbalance in that can cause and alter your mood. And so if there's anything going on there, then if you've tried things like exercising, you've tried things like reducing stress, eating better, being outside, exposing yourself to the sun, and counseling and improving your support system, and you're still not seeing the benefits or the improvement, then it might be time to treat yourself. And by that I mean, of course, being seen by your physician and discussing the possibility of getting started on something. And antidepressants or anti-anxiety medications are typically things that work slowly. And so this is a medication that you would start and be on for a relatively long time. Oftentimes my patients think that they need to get off of it as soon as they can because they want to just feel like themselves and then stop taking the treatment. But anxiety and depression is not one of those conditions, and especially if it's a chemical imbalance, like I said about your pancreas, you don't try to necessarily get off the medication. It could be something you're on as part of your routine for your lifelong wellness. And that's okay, because this is important. And for us, this is critical in terms of making sure that everything else in our body is going okay. And so I'm a huge proponent of being aware of your emotional balance and an advocate for women, having that kind of self-reflection and within themselves and also in each other. Let's look out for each other. And if you feel like something's off within you, if you feel like something's off in a woman you know and care about, bring your attention to that and encourage them to take some action. And if you have any questions, as always, you are more than welcome to send them my way. And I'm gonna get back to my family, but thank you so much for tuning in. And